Hello, my name is Dr. Olubukola Ayodele. I'm a breast oncologist, and what that means is that I treat breast cancer. Your power lies with knowledge. Therefore, I'm here to empower you today by giving you some information about breast cancer. So let's start. What is breast cancer? Well, our bodies are made up of tiny cells. These cells are controlled by proteins directed by your genetic makeup, and these are called hormones. Occasionally, you can have situations where these cells start to grow abnormally and rapidly. If this happens in the breast, it can develop into what's called a tumor, which is seen as a lump. However, not all lumps are breast cancer. Breast cancer tends to happen when this lump or when this tumor goes into the surrounding cells. You cannot tell by touch or by sight if that lump has cancer cells in it. Therefore, if you feel a lump, it's really important that you go to your doctor as soon as possible. Your doctor would examine you and send you for further tests, such as a mammogram, an ultrasound, and a biopsy. It's only through a biopsy that we can truly tell if that lump contains cancer cells. It's really important that you go to your GP or to your family doctor as soon as you notice anything, because breast cancer, if diagnosed early, is treatable and in many times can be cured. In many cases, people who would develop breast cancer tend to go on to have a fulfilled life. However, what we have seen is that a lot of people tend to present quite late, meaning that the outcomes and the treatment becomes more complex. So, what do? It's best that you empower yourself with what's called a self-breast examination. A self-breast examination is how you check your breast by yourself. You don't need an invitation to do that. If you are a man, yes, men can get breast cancer. If you're a man or woman, and for the women who are no longer having their periods, then it's preferred that you do a breast examination on the first of every month. It's easy to remember. You put it in your diary. If you are a woman who is still menstruating, which we call premenopausal, then it's preferable that you do the self-breast examination on day 7 to 10 of your period, where day 1 is the first day of your period. And the reason we advise is that any swelling or tenderness associated with your period then has had a chance to reduce so that you can feel your breast adequately. It's really important, like I said, to make sure that if you feel anything abnormal, that you go to your GP. But how can you know abnormal if you've not been checking? So I need you to keep sharing this information with your loved ones so that they also know that they need to keep checking and what breast cancer does involve. So until next time, keep sharing, don't keep silent, and keep checking.